Good afternoon, everyone. This is Dr. Sagar P. Kabadi, the consultant medical gastroenterologist, Atrium Hospital, R Nagar, Bangalore. So, I'd like to have a brief presentation today on GERD, that is gastroesophageal reflux disease. We commonly encounter these reflux diseases in our day-to-day lives, and I would like to create more awareness today regarding this. As a gastroenterologist, I come I come across these diseases, the heartburn issues, the belching, and upper GI discomfort symptoms very often in my OPD. So I would like to create some awareness and some I would like to burst some myths that is present along with this. Okay, so let me introduce to this topic briefly. So what is GERD? GERD is basically gastroesophageal reflux disease. Okay, this basically these are symptoms of mucosal damage produced by an abnormal reflux of gastric contents into the esophagus. Okay, so normally our stomach contains of acidic contents. So these acidic contents are not supposed to go into the esophagus. Okay, once this acidic contents uh, can occur, tend to go inside the esophagus, only then we would call it GERD. Okay, it happens due to multiple reasons. It can happen physiologically or it can happen pathologically. Okay, so this is most commonly encountered. Sometimes people mistake it for gastritis. Gastritis is different. So GERD is different. Can occur at all age groups, but it is more commonly up over the age of 40. Okay, so about 10 to 20% of people worldwide suffer from GERD symptoms on a weekly basis. Okay, and about 7% of people worldwide suffer it on a daily basis. So the magnitude of this GERD is quite significant because we deal with GERD on everyday basis, a daily basis, and some people tend to overlook it. Some people are overdiagnosed, some people are underdiagnosed, some people fail to treat it even if they are diagnosed, and they end up in complications. So it is a very important topic to be seen, to know about on a different scales on an everyday basis. Okay, so right from every person has taking different medications for different purposes, like for heart diseases, like for diabetes. Every other alternative medications can also cause these GERD symptoms as well. Okay, so these things are very important to know how to avoid these things. Okay, so before coming to the GERD, let us know what exactly the anatomy of the esophagus. I'll quickly tell you a little bit in detail. So this is the upper esophageal sphincter and there is a lower esophageal sphincter. Okay, so the once the food enters the esophagus, the upper esophageal sphincter is opened and it allows the passage of food through the pipe, and then there is the release of the lower esophageal sphincter. This is how the bolus of the food is allowed from above, below, downwards. So the two sphincters is very important for our passage of movement from up to below to into the stomach. So what happens? So in a normal healthy stomach, this lower esophageal sphincter is closed. Um, whenever there is as the sphincter is loose, what happens? There is a reflux of. So when the lower esophageal sphincter reflux, when the lower esophageal sphincter is loose, what happens? The acidic contents and the gastric content, whatever, normally every stomach has good amount of acid content in it. Okay, so this acid content should not be released into the esophagus. In a normal healthy stomach, this sphincter is closed. When this sphincter is open, what happens? The acidic contents and the gastric contents and also the food contents slowly tends to ascend upwards because there is an open gap. Usually it goes only below, but here in this case, when the lower esophageal sphincter is loose or does not act properly, or the valve is for some extent little bit of damage has occurred to this valve. Okay, then the valve does not function adequately, and then the person has a lot of symptoms. Okay, let's understand why this lower esophageal sphincter does not function well, or why the origin of the problem happens. There is a few pathology behind it. Okay, so the primary barrier to the gastroesophageal reflux is the lower sphincter. If the barrier is disrupted, acid directly goes from stomach into the esophagus. So this is the stomach, this is the acidic content which are there. Normally it will be closed. Here it ascends upwards. Why it does not upward? Because there is decreased pressure. There is decreased LES, lower esophageal sphincter. This can be assessed by a esophageal manometry. So this sphincter pressure may be the sphincter pressure may be loose in elderly people, in lax muscles. Uh, Obese individuals, all these the sphincter can be lax. Once the sphincter is lax in few pressures, so then there will be a reflux of acidic contents. Reflux of acidic contents. Endoscopically visualize lower esophageal sphincter. On the left side, you can see this is the normal sphincter which closed down once the food bolus has entered the stomach. But in the right side, as you can see, the sphincter remains open here, allowing the passage of food from below upwards and above downwards both. So what happens when there is the free valve is open like this, there is a free movement of acidic contents and stomach contents that is going in and out of the stomach. That should not happen on a routine basis. Okay, so only then there will be a lot of mucosal damage that is occurring upwards into the esophagus. So that is why we'll have a lot of problems. So secondly, the first one I told was the disruption of the LES pressure. The second is the disruption of the anatomical barriers. Sometimes what happens, the entire proximal stomach has ascend upwards. Okay, a part of the stomach, the part of the stomach, the proximal stomach has to remain below the diaphragm. What happens? The stomach, a part of the stomach ascends upwards and goes above the diaphragm, causing it hiatus hernia. Okay, is also quite this causes quite significant symptoms and significant damage to our upper esophagus, and eventually can land up in complications such as vomiting blood or having decreased appetite, loss of weight, and a lot of belching, retrosternal discomfort, burning sensation, all those things, because the entire stomach, there is no valve here. Okay, there is a free movement of all the acidic contents of the stomach flowing freely into the esophagus. So that will also cause a lot of problem. So how do you know you have GERD? How to recognize yourself that you probably have GERD symptoms? Constant heartburn and retrosternal burning sensation. Okay, so a person subjectively has lot of heartburn. Continuously the patient will have retrosternal burning sensation. Also, you feel like there is regurgitation of gastric contents, that is effortlessly you feel a vomitus in your mouth or acidic content in your mouth. Only then you would probably feel that probably you have GERD. And belching, obviously when there is lot of gas that is produced inside the stomach, that is reflecting and the sphincter is loose, though you will have a lot of belching and upper abdominal discomfort. Like all these symptoms will definitely produce some amount of discomfort, catch, irritation, pricking sensation, pain. All these things can be seamlessly be a part of GERD itself. Sometimes, most of the time, what happens, you end up to a cardiologist getting an ECG done, but the ECG reveals that it is normal study. But even then, you have a pricking sensation, pain, the retrosternal pain, retrosternal area. You keep describing vague pains and discomfort. So that probably is something related to GERD. Atypical symptoms that also be present, such as nocturnal cough. What is nocturnal cough? The night irritation. Sometimes what happens, these acidic contents from the stomach can ascend upwards into the esophagus and all the way reach the trachea above, and also go inside the lungs and cause irritation in the trachea and eventually cause cough. It is also called non-allergic asthma. So these symptoms can also produce hoarseness of voice, irritation in the throat, and also chest pain, like I already told you. Hoarseness of voice, pharyngitis, is all because of the acidic contents reflecting all the way above up to the throat. So only then there is symptoms that is produced in the upper esophagus and in the throat. Okay, so it may be present retrosternally or also in the upper esophagus. So now that we know what are the symptoms of GERD, let us come to the diagnosis of GERD. How do I diagnose myself whether do I have a GERD and its related problems? Okay, there is barium swallow, endoscopy, ambulatory pH monitoring, acid perfusion test, and esophageal manometry. Out of these tests, endoscopy is the most simplest form of test that is done on a routine OPD basis that helps in diagnosis multiple issues. Okay, barium swallow, ambulatory acid perfusion test, and all these things are not done on a routine basis. Esophageal manometry is indicated only to assess the pressure of the lower esophageal sphincter. Okay, but in endoscopy, almost everything will be recognized in more than 70 to 80% of the individuals. Endoscopy is more than enough to diagnose most of the GERD symptoms. Okay,